Hello. Okay, so this is my M5 presentation. So I have my notes on the side. So if I'm looking to the side, that's what I'm looking at. But okay, so for the first question, my initial reaction to the assignment, I was a little bit nervous because 5 to 8 minutes is a long time to talk about a topic like this. I felt like so I was a little nervous until I started reading through the PowerPoints more and getting a better understanding of the material. But in addition, I was having a hard time finding the correlation between health literacy and public speaking. So I think that I got a better grasp on it once I started to understand the theories and the models. But there still is a little bit of a gray area for me as far as the connection between the two. So hopefully I figured it out well enough to make sense. But and then for number two, okay, so why public speaking is important to health communication and education. So I found a source for this online and by an author by the name of Dr. Bernhardt, I think it's pronounced, and he said, the realization that both science and communication are essential to promoting and protecting the health of the public was a major milestone in the emerging discipline of public health communication, reinforcing its vital role as a new core component of public health. So the big thing with this that stuck out to me was realizing that both science and communication are equally as essential in promoting health. So I think it's very easy for health educators coming from a very scientific background and a high level of education to focus primarily on the scientific aspects rather than looking at how they're portraying this information rather than just the facts, black and white. And I think that this makes these health professionals more personable and more relatable and more human, and it makes people feel more comfortable and more likely to be open to what they're saying because they feel like they're coming at them eye to eye rather than from an upper level. So that was the biggest thing that I found when reading through the PowerPoint presentations. And the biggest thing additionally that I found was the authenticity of individuals who are focusing on the communication aspect as well. So the biggest part for this that I noticed was the theories and models. So these I got from the PowerPoint. So it was like M5 chapter 7 and 8, I believe. And let me just flip to my page on that. Okay, so the ones that I found to be most important specifically in connecting health literacy with public speaking and the importance of it, it focused on things like the theory of planned behavior, which focuses on individuals' intention for predicting behavior. So I think that this is super crucial in public speaking about specific health topics because understanding why an individual is behaving and making the decisions that they are can be super vital to explaining your information in a way that's going to be appealing to them and going to be helpful for them. So that was one theory that I found to be super important. Additionally, the health behavior model to explain why or why not people use health services. I thought this was super important too because it focuses primarily on what keeps people from coming in to seek help or utilizing health resources or health professionals as a way to better their own personal health. And the biggest part of this was focused on age, race, social class, ethnic diversity, things like that. So I found this to be super interesting because I know that personally speaking, coming from somebody who's had somebody that I cared about refuse to seek medical help or services out of fear of not being educated enough to understand or not getting the proper treatment based off of their skin color or things like that, just feeling like they weren't going to be heard or understood speaking to somebody with a medical background. So I think that by using this health belief model, professionals are going to be able to better present their information when they're public speaking to this group of individuals in a way that's going to make them feel comfortable and welcome and respected as an individual rather than just another name on a paper or another patient on a list. In addition, the diffusion theory distinguishes differences in how involved people get. So this, and as well as I believe it's the the stages of change theory. So the importance for this in public speaking was distinguishing how involved people get. So it talked about the innovators, the early adopters, and then the laggers. And I think that's super important because it forces the health professionals that are giving the speeches to understand that everybody in their audience is going to be at a different place in their readiness to not only adapt to the changes that they're being told, and as well as how likely they are to jump on board with believing that it's going to be worth it. And I think that's just super crucial to understand that, because the health professional can come at them in a way that isn't out of frustration with their lack of willingness to jump right on board with whatever it is they're trying to communicate, but rather understanding that everybody's in a different place and they're going to jump on when they're ready, and there's a chance that they're going to come off and then come back, and that's totally okay, and it's all normal and part of the process. So I think that understanding that can allow health professionals to speak to their audience in a way that is a bit more human, a bit more authentic, which an audience would be more likely to take to than somebody who is saying, this is what you need to do. If you don't do it, you're gonna experience this, this, and this, and that's all there is to it. Just do it. This takes into account all aspects of their health, and additionally, it kind of allows them to be easier on themselves as far as understanding that it's going to be a journey, whatever the changes they're trying to adopt, and that's totally okay. For question 3, it discusses how I plan to improve and how others can improve. So for this, I found another outside source, and it said the title of the source was 5 Ways Public Health Professionals Can Improve Their Communication Skills. And I know the question asked how I can improve my communication skills in a health environment, but I wanted to see from a more professional standpoint what they thought was the best way. And it says in public health, being able to engage with the audience is critical. If you cannot capture the attention of the people whom you're working with, it will be hard to ensure that they really hear your message. This is why it's so important to think about who you're speaking with before you begin preparing. So this kind of goes back to the authenticity factor and utilizing the models as far as knowing your audience and being willing to take a step back and hear where they're coming from, hear their experience with health care in the past, and kind of walk with them in their health journey wherever they're at. So that's the biggest thing for me, just understanding that I need to meet people where they're at and not get frustrated if they don't take to it as quickly as I'd like them to.